Hi everyone. Today in this video let us discuss Carisoprodol. What is this drug Carisoprodol? This is one of the centrally acting muscle relaxant. This drug can be used in the treatment of muscle spasms where muscle pain exists for a short period. So Carisoprodol can be used for short-term management of muscle pain. It can be used up to 2 to 3 weeks in order to control the muscular pain. Actually, Carisoprodol is one of the prodrug which is going to be metabolized within the liver. This drug can undergo dealkylation so that it can produce another active metabolite, meprobamate. This meprobamate is another centrally acting muscle relaxant. So, Carisoprodol is a prodrug of meprobamate. So, today in this video we are going to see how this drug acts, what are the important precautions, side effects, doses, all these things we will discuss in this video. Now let us see how this drug acts. Within the CNS, excitatory neurons can carry neurotransmitters such as glutamate, which is an excitatory neurotransmitter. These excitatory neurons can act on motor neurons, which are equipped with glutamate receptors such as AMPA receptors. These AMPA receptors are responsible for fast synaptic activation, resulting in the stimulation of motor neuron and subsequent muscle contraction. Similarly, the descending inhibitory pathways also exist, which are storing inhibitory neurotransmitters such as GABA. Now, on the motor neurons, another type of receptors such as GABA receptors exist, which are activated by GABA to produce inhibitory response on the motor neuron. Now, when action potential reaches to the excitatory neurons, glutamate can be released and it can act on AMP receptors, which opens the sodium channels, resulting in the depolarization of the motor neurons. This depolarization is going to be carried through the motor neurons to the skeletal muscle, resulting in the contraction of the skeletal muscle. Now, this contractile mechanism is controlled by GABA, where GABA can act on GABA receptors, resulting in the decreased depolarization within the motor neuron. In this way, motor neuron can be activated by both excitatory neurotransmitters as well as inhibitory neurotransmitters. Now, Carisoprodol is one of the centrally acting skeletal muscle relaxant. It can be converted into its active metabolite meprobamate, which can bind to GABA A receptors expressed on motor neurons. This opens the chloride channels, so chloride ions can enter into the motor neuron, which produce hyperpolarization, resulting in the inhibition of motor neuron. In this way, Carisoprodol can reduce the muscle activation by increasing the activity of descending inhibitory pathways. Carisoprodol can produce some addiction and it can act as drug of abuse because of more sedative and anxiolytic activity as it acts on GABA A receptors. Now let us see the precautions. One of the important precautions of Carisoprodol is that since it is acting centrally and activates the GABA A receptors, so it can produce sedation as one of the important side effects. So when this drug is indicated as muscle relaxant, it can produce some sedation and drowsiness, which can impair the daytime activities such as driving the vehicles or working with machinery. It can impair the daytime activities where care should be taken. Because of drowsiness, it can produce some accidents during the driving as well as working with machinery. And particularly this sedation is further increased by co-administration with alcohol, because alcohol again produces CNS depression. Similarly, if you have the drugs like CNS depressants such as opioids, benzodiazepines, they can further increase the sedation when they are given along with Carisoprodol. So, Carisoprodol should be carefully given along with other CNS depressants. Similarly, when this drug is given at high dose, it can produce various effects. Particularly, it can produce the CNS depression, resulting in the sedation, drowsiness and lightheadedness. It can also produce respiratory depression, resulting in the difficulty in breathing. And finally, at very high dose, it can induce the seizures within the patients. Similarly, when this drug is suddenly withdrawn, it can produce some withdrawal symptoms. So, within the patients, we can observe some nausea and vomiting, headache, abdominal cramps, hypotension, and even it can induce the seizures. So, this drug should not be suddenly withdrawn and the dose should be slowly reduced in order to avoid withdrawal symptoms. What are the side effects? The important side effects of this drug are mainly related with central inhibition, can produce some drowsiness, dizziness, headache, postural hypotension, vertigo, reeling sensation, ataxia, loss of balance. It can also produce some facial flushing resulting in the redness of the face, agitation, tremor, and it can also produce some abdominal pain and cramps within the patients. Now let us see the chemical nature of this drug. So this is the structure of Carisoprodol, and here we can observe this moiety. This is nothing but the carbamate moiety. On the nitrogen of this carbamate, it is having the isopropyl chain, which can be written as N-propane-2-ol. Now on the other side, we can observe a long chain. Let us give the numbering. This is 1, 2, 3, 4, 5. So this is the pentyl chain, which is having a methyl group at the second position. So we can write this as 2-methyl-pentyl. And again at the second position, it is having another chain which can be written as 2-carbamoyl oxymethyl. So that is the complete name of Carisoprodol. How it is given? This drug is available as tablets at a strength of 250 mg and 350 mg. The dose is variable from 250 to 350 mg, given as thrice daily. But the treatment should be continued for short period. So this drug is given up to 2 to 3 weeks in order to control muscular spasm within the patients. So that's about this drug Carisoprodol, which is a centrally acting muscle relaxant. This drug is a prodrug of another centrally acting muscle relaxant, meprobamate. Active metabolite is responsible for activation of GABA A receptors, which produce sedation, anxiolytic effects, and muscle relaxant effects. And because of this sedative nature, this drug can produce some drug addiction, so it can act as drug of abuse. But under therapeutic dose for short-term treatment, it can reduce the muscle spasm, with sedation as the important precaution that should be considered. Drowsiness and dizziness are the two important side effects that can be considered with this Carisoprodol. So that's about this drug Carisoprodol. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.